Okay, so you've really outdone yourselves this time. I mean, wow, this stack of research papers, articles, and even some chapters from T. Lott's book, Respiratory Infections, A Guide to Recovery, is impressive.
It's quite the collection.
It really is. And, diving into all this is going to be quite the deep dive. But that's exactly what we're here for, right?
That's right.
To take all this information and distill it down into those key insights that you really need to know.
Absolutely.
So you can walk away feeling truly informed about respiratory infections without, getting bogged down in all the technical jargon and the complexities.
Exactly.
So where do we even begin with all of this?
Well, I think a good place to start is, what are these infections?
Yeah, what are they?
What are respiratory infections? How do they affect our breathing? What are the different types, the causes, the traditional treatments, some alternative and preventative strategies, and then some specific things to consider depending on, maybe age group.
Okay, that sounds like a plan.
Yeah.
Let's dive in. So let's start with the very basics. What exactly are respiratory infections?
Well, in the simplest terms, they're illnesses that affect your respiratory system. Your lungs, the airway, everything involved in breathing.
Right.
And as you've probably seen in all the material you sent, the main culprits are those pathogens, those tiny little viruses and bacteria.
Okay.
But it's also worth noting that environmental factors can play a role too.
Okay.
Things like air pollution allergies, those can also irritate your respiratory system and potentially even make you more susceptible to getting an infection.
So it's not just about catching a bug from someone else.
Right, exactly.
Yeah.
While the vast majority of these infections are caused by these infectious agents, these other factors are still important to consider.
Okay.
And, this is a huge global health concern.
Really?
Millions of people are affected by respiratory infections every single year.
Wow.
And unfortunately, the death toll can be significant, particularly among young children.
Oh, wow.
As many of the studies that you sent highlight.
Okay.
This puts an immense burden on healthcare systems worldwide.
Yeah, I can imagine.
And leads to significant economic losses due to people missing work and, decreased productivity.
Wow. It's kind of mind-boggling when you think about the sheer scale of it all.
It really is.
To understand how these infections really impact us, I think maybe we should take a closer look at the respiratory system itself.
Yeah, I think that's a fantastic idea.
Okay.
So think of it as like a two-part system.
Okay, a two-parter.
You have the upper respiratory tract. That's your nose, your sinuses, pharynx, larynx.
Okay.
And this is like the first line of defense.
Okay.
This is where the air that you breathe in gets filtered, warmed, and humidified before it reaches your lungs.
So like a natural air purifier and humidifier all in one.
Exactly.
That's pretty amazing.
It is.
Then we have the lower respiratory tract.
Right. The lower respiratory tract starts with the trachea, your windpipe.
Uh-huh.
And that branches into two main bronchi, one for each lung.
Okay.
And these bronchi keep branching out into smaller and smaller tubes called bronchioles. And at the very end of these tiny bronchioles, you have the alveoli.
And those are the little air sacs that are crucial for breathing, right?
That's right. They're these tiny little sacs surrounded by a network of capillaries, those tiny blood vessels. Oh. And it's in the alveoli where the actual gas exchange takes place.
So oxygen in carbon dioxide, out the fundamental exchange that keeps us going.
That's it. Oxygen from the air you breathe diffuses across the thin walls of the alveoli into your bloodstream. And at the same time, carbon dioxide, which is a waste product from your body's cells, moves from the blood into the alveoli to be exhaled.
Okay.
So these tiny microscopic sacs, as you can see in those detailed diagrams in your research, are the literal interface between you and the outside world.
That's pretty incredible when you think about it.
It is.
And I know we can't forget about the muscles that actually power breathing.
Right. You have the diaphragm, which is that dome-shaped muscle that sits at the base of your chest.
Okay.
And then you have the intercostal muscles, which are the muscles between your ribs.
Okay. And these muscles work together to help you inhale and exhale.
So how do they do that?
When you inhale, the diaphragm contracts and flattens, and the intercostal muscles lift your rib cage.
Okay.
This increases the volume of your chest cavity, which creates lower pressure inside your lungs compared to the outside air, and that causes air to rush in.
Interesting. So that's inhalation.
Exactly.
And then what about exhalation?
Exhalation is often more passive. Yeah. The diaphragm and the intercostals relax. The chest cavity gets smaller and air is forced out.
Okay, so it's kind of like a push and pull system.
Exactly.
That's really fascinating. I remember reading in T. Lott's book about some of our natural defenses against infection in the respiratory system.
You're right. We have this amazing thing called mucus.
Mucus?
Yeah, it lines the entire respiratory tract, acting like a sticky trap to capture those pathogens and other inhaled particles.
Okay.
And then we have cilia.
Cilia.
Yeah, these tiny hair-like projections on the cells lining your airways. And they beat in this coordinated wave-like motion, kind of like a microscopic escalator. Wow.
Constantly moving the mucus with all the trapped debris upwards towards your throat, so you can either cough it up or swallow it.
Oh, so that's how we get rid of all that gunk.
Exactly. This whole process is called mucociliary clearance.
Mucociliary clearance.
It's like a tiny little escalator constantly working to keep you healthy.
That's pretty amazing.
It is. And when the system gets overwhelmed, that's often when infections can take hold.
So when an infection does take hold, how does it actually mess with our breathing?
Well, those infectious agents, they trigger inflammation in your airways.
Okay.
And this inflammation causes the airways to swell and narrow, which reduces the space available for air to flow in and out.
Oh, I see.
So it makes it harder for your body to get enough oxygen and to effectively get rid of carbon dioxide.
So it's almost like trying to breathe through a straw.
Exactly.
That makes a lot of sense. Now, we always hear all these different terms, URIs, LRIs, viral, bacterial. Could you break down the different types of respiratory infections for us?
Yeah, absolutely. So we typically categorize them based on where in the respiratory system they primarily occur.
Okay.
So upper respiratory infections, or URIs,
Uh-huh.
those affect the upper parts of your respiratory system, your nose, sinuses, and throat.
Okay.
Common examples are the common cold, sinusitis, tonsillitis.
Right.
And as you probably saw in your research, these are very often caused by viruses.
Okay.
And they tend to be on the milder side.
So symptoms are usually...
Things like nasal congestion, sore throat, maybe a light cough.
Okay, so this is the kind of thing where you just need to let it run its course?
Often, yes.
Okay.
Then you have lower respiratory infections, or LRIs.
Uh-huh.
And these affect the lungs and the airways. Things like bronchitis, pneumonia, bronchiolitis.
Okay.
And these can be caused by both viruses and bacteria.
Oh, so they're a little bit trickier.
A little bit, yeah. And they're generally more severe and often require medical attention.
So if you have those, you definitely see a doctor.
Yeah. Pneumonia, for example, is a serious infection of the lungs where the air sacs can become inflamed and filled with fluid or pus.
Oh, that sounds pretty serious.
It can be.
Yeah.
And then there's the distinction between viral and bacterial infections.
Right, because I know that those require different approaches.
Absolutely. That's a crucial distinction. And as you've probably gathered from your reading, they need to be treated differently.
Yeah.
Viral respiratory infections like the flu or RSV, respiratory syncytial virus,
Uh-huh.
they're often less severe initially and might even resolve on their own without antibiotics.
Right, because antibiotics only work on bacteria.
Exactly. Antibiotics target bacteria, not viruses.
Okay.
So bacterial respiratory infections like strep throat or bacterial pneumonia, those might actually require antibiotics for effective treatment.
Yeah,
So understanding this difference is really important for smart treatment.
avoiding those unnecessary antibiotics.
Exactly, which is a huge problem.
Yeah, we hear about that all the time, antibiotic resistance.
Yeah, it's a big issue. So healthcare providers really need to figure out, is it viral or bacterial to guide the right course of action?
Okay, that makes sense. So let's zoom in on a few of those common infections.
Yeah.
The common cold, the flu RSV.
Okay.
What are some of the key differences there that can help us kind of tell them apart?
So the common cold is usually the mildest of the three.
Okay.
You'll typically experience symptoms like nasal congestion, sore throat, maybe a light cough.
Right.
They're usually manageable with those over-the-counter remedies and tend to resolve within about a week.
Okay, so the common cold is the one where you just got to power through it.
Pretty much.
Okay.
The flu, however, tends to be much more intense.
Okay, so how is it different?
You're more likely to have a fever, significant muscle aches, and just that overwhelming fatigue
Oh, yeah.
that really knocks you off your feet.
Yeah, the flu is definitely no joke.
No, it's not.
Yeah.
While most people do recover from the flu, it can lead to more serious complications.
How, like what?
Like pneumonia, particularly in those who are at higher risk. Antiviral medications, if started early in the illness, can help to reduce the duration and severity of the flu.
Oh, that's good to know. So the flu really hits you like a ton of bricks.
It can, yeah.
What about RSV? We hear a lot about that one, especially with young kids.
Yeah, RSV can range from mild cold-like symptoms to something much more critical,
Okay.
especially for infants and older adults.
So this can be really serious for those age groups.
It can. It causes significant coughing, wheezing, breathing difficulties, and in severe cases can lead to bronchiolitis or pneumonia.
Wow.
So it's a major concern for those vulnerable groups.
Okay, that gives us a much clearer picture of what these infections are and how they actually differ. Now let's move on to the diagnostic part.
Yeah.
When you actually go to the doctor feeling unwell, what are some of the things that they do to figure out what's going on?
Well, the process usually starts with a good old-fashioned physical exam.
Okay.
The doctor will listen to your breathing with a stethoscope.
Uh-huh.
That's called auscultation.
Auscultation.
It's a fancy word for listening to your lungs. They're listening for any abnormal sounds like wheezing or crackles, which could indicate problems in the airways or lungs.
Okay.
They'll also observe your breathing patterns and probably examine your nose and throat for signs of infection.
Yeah, the classic say, ah moment.
Exactly. If they need more information, imaging techniques can be really helpful.
Like what?
Chest x-rays are often the first imaging study done to look for signs of pneumonia or other lung issues.
Okay.
For a more detailed view, they might do a CT scan.
What's the difference?
A CT scan takes cross-sectional images of your lungs and the surrounding structures.
So it's like slicing through your lungs with a laser.
Pretty much.
Yeah.
So X-rays give a general overview, and CT scans provide much more detail.
That's interesting. Then there's also sputum analysis, right?
Yes, if you're producing mucus from your lower airways, they can take a sample of that and send it to the lab.
Okay.
They can do cultures to try to identify any bacteria, fungi, or viruses that might be present.
Okay.
And a gram stain is a quick test that helps to classify bacteria. And if bacteria are found, they can do antibiotic sensitivity testing.
And what is that?
That determines which antibiotics are most likely to be effective against that specific bacteria.
Oh, so it's about tailoring the treatment to the actual bug that's causing the problem.
Exactly. Personalized medicine.
That makes sense. What about blood tests? What kind of information do those give?
Blood tests can be really helpful, too.
In what way?
They can give a lot of information about what's going on inside your body.
Okay.
A complete blood count, or CBC,
Uh-huh.
can show if your white blood cell count is elevated, which often happens when you have an infection.
Okay.
Then there's C-reactive protein, or CRP, which is a marker of inflammation in your body.
Uh-huh.
And its levels can be raised during respiratory infections.
Interesting. And what about this procalcitonin thing? I've seen that in some of the research.
Right, procalcitonin, or PCT, is a biomarker that can sometimes help doctors distinguish between bacterial and viral infections.
Okay, so how does that work?
It tends to be higher in bacterial infections.
Oh, I see.
And remembering how important it is to differentiate between those two types of infections,
All right.
Mainly to avoid unnecessary antibiotics,
Absolutely.
really gives you a good understanding of why these tests are used.
That makes a lot of sense.
In more severe cases, like suspected bacterial pneumonia, they might even do blood cultures to try and identify the specific bacteria that's entered your bloodstream.
Okay, so blood tests basically give a snapshot of how your body is reacting to the infection.
Exactly. And then to really assess your lung function, there are pulmonary function tests, or PFTs.
Pulmonary function tests.
Yeah, one of the common ones is spirometry.
And how does that work?
You breathe forcefully into a device that measures how much air you can inhale and exhale and how quickly you can do it.
Okay.
There are also tests to measure your lung volumes and the diffusion capacity, how efficiently oxygen and carbon dioxide are being exchanged in your lungs.
It's like a full checkup for your lungs.
Exactly. And finally, we have those rapid tests that you often hear about for things like flu and RSV.
Right, those are the ones you can get at the doctor's office.
Yes. Rapid diagnostic tests for flu and RSV are really useful for getting quick results.
Okay.
They usually involve a nasal swab or wash to detect specific viral antigens, which are basically markers of the virus.
Okay.
And they can give results relatively quickly, which can help guide early treatment and infection control.
Right.
But it's important to note that these tests aren't foolproof.
Okay.
They can sometimes give false negatives, especially early on in the illness.
So it's good to be aware of that.
Yes.
Okay, so we have this whole arsenal of diagnostic tools that doctors use to figure out what's going on. Now let's talk about the traditional treatments for these infections.
Right. The treatment really depends on what type of infection is diagnosed.
Okay, makes sense.
For bacterial infections, antibiotics are the main treatment.
Okay.
They work by targeting and killing bacteria or stopping their growth.
Oh.
But it's absolutely vital to get the right diagnosis before you start antibiotics.
To make sure that you actually need them.
Exactly. You need to complete the entire course as prescribed, even if you start feeling better.
Right. Don't stop early.
Exactly. Because that can lead to antibiotic resistance.
And that's a big problem.
It is.
Yeah.
And as with any medication, antibiotics can have potential side effects.
Right, so they're powerful tools, but they need to be used responsibly.
Exactly. Now, for viral infections, we know antibiotics aren't effective.
Right.
But for certain viral infections like the flu, there are antiviral medications.
Okay.
These are most effective when they're started early in the illness.
Okay, so you got to catch it early.
Yeah, medications like oseltamivir or Tamiflu and zanamivir or Relenza,
Yeah, I've heard of those.
they can help reduce the duration and severity of the flu.
Okay.
They interfere with the virus's ability to replicate and spread.
So they stop it from taking over your body.
Exactly. For RSV, there's an antiviral medication called ribavirin
Okay.
that might be used in certain high-risk individuals,
Like who?
like premature infants or people with underlying health conditions. However, for a lot of viral infections, the focus of treatment is often supportive care.
And what exactly does that mean?
Supportive care is all about helping your body recover naturally.
Okay.
So things like getting enough rest,
Uh-huh.
aiming for 7 to 9 hours of sleep,
Okay.
staying well hydrated by drinking lots of fluids,
Okay.
like water or clear broths to help thin the mucus,
Yeah.
and eating a healthy diet full of fruits, vegetables, and lean proteins.
So all the basic things that we should be doing anyway.
Exactly, but they become even more important when you're sick.
Right, because your body needs those nutrients to fight off the infection.
That's right. And then there are over-the-counter or OTC medications.
Okay.
Decongestants can help relieve nasal congestion.
How do they do that?
They narrow the blood vessels in your nasal passages.
Oh, okay.
Pain relievers like acetaminophen or ibuprofen,
Uh-huh.
those can help manage fever and body aches.
So those are just for symptom relief.
Exactly. They don't cure the infection. They just help you feel better while your immune system does its job.
So it's important to remember that they're not actually fighting the infection.
Right. And then always follow the dosage instructions carefully.
Absolutely.
So what about prescription medications other than antibiotics and antivirals?
Yeah, for certain respiratory conditions or more severe infections, doctors might prescribe other things.
Like what?
Bronchodilators.
Bronchodilators.
Yeah, those help to relax the muscles around your airways, widening them and making it easier to breathe.
Okay.
They're often delivered through inhalers.
Oh, okay.
Then there are steroids,
Mm-hmm.
like inhaled corticosteroids or oral steroids.
And those help with?
They help reduce inflammation in the airways,
Oh, okay.
which can be a big factor in breathing difficulties.
So bronchodilators open things up and steroids calm things down.
Exactly.
What about those really serious cases where, things get really bad?
In those cases, hospitalization might be necessary.
Okay.
That allows for more intensive support, like oxygen therapy.
Oh, to help get enough oxygen into your blood. And in very critical situations, they might even use mechanical ventilation.
Which is?
It's a machine that helps you breathe.
Okay.
Or even ECMO,
What's that stand for?
extracorporeal membrane oxygenation.
Okay. I'm not even going to try to say that.
Yeah, it's a mouthful.
It is.
But it basically provides external heart and lung support.
Wow. So that's like really serious life support.
Yeah, and for severe bacterial infections, they might administer intravenous antibiotics.
Which is?
They go directly into your bloodstream for faster and more effective treatment.
Okay. So that's when things are really, really serious. Now let's shift gears a bit and talk about some of the alternative and home remedies that people use.
Okay.
What's the perspective on those?
It's important to remember that these should generally be considered complementary approaches.
Meaning?
They can be used alongside traditional medical treatment,
Okay.
but you should always seek professional medical advice when you're ill.
So don't just rely on home remedies if you're feeling really sick.
Exactly. But some of these remedies can offer comfort and might have some supportive benefits.
Like what?
Herbal remedies, for example,
Okay.
like garlic, ginger, echinacea.
Uh-huh.
Those have been traditionally used for their antimicrobial or anti-inflammatory properties.
Interesting.
Or for immune support.
Okay.
However, it's important to be aware of potential interactions with other medications you might be taking.
Right.
Always consult with your doctor or pharmacist before using herbal remedies.
That's good advice. And I know some people talk about colloidal silver and ivermectin.
Yeah, those have been mentioned in the context of antiviral effects. The scientific evidence supporting those uses is still evolving.
Okay, so it's not really clear cut.
Not yet, and you should definitely exercise caution because there are potential side effects.
So again, talk to your doctor first.
Absolutely. Now, what about some of those more common home comfort measures that people often turn to?
Yeah, like steam inhalation and humidifiers.
Right, those can definitely help loosen mucus and soothe those irritated airways.
Oh, that makes sense.
And nasal irrigation with saline solutions.
Using those neti pots.
Yeah, or even just saline sprays can help hydrate your nasal passages and thin the mucus,
Yeah, okay.
which can help clear out allergens and irritants.
Just make sure you're using the right water.
Right. Use distilled or sterile water for nasal irrigation
Oh, cool.
to avoid any risk of infection.
Good tip. And I know a lot of people swear by honey and lemon for coughs.
Yeah, that can be a soothing combo for cough relief.
Mm-hmm.
It helps coat the throat and potentially even thin the mucus.
Okay.
But remember, honey should never be given to infants under 1 year old.
Right. Because of the risk of botulism.
Exactly.
Yeah.
And of course, getting plenty of rest and finding ways to reduce stress are always important.
Yeah. Especially when you're sick.
Absolutely. They help support your immune system.
Okay. So those simple things can really make a difference.
They can. So when do you think someone should consider using home remedies, and when should they see a doctor?
Well, I think if you have mild symptoms, home remedies can definitely help. But if you have difficulty breathing a high fever that doesn't go away, or if your symptoms are getting worse instead of better, it's definitely time to see a doctor.
Right. You don't want to mess around with those.
No, absolutely.
No.
And especially if you have any underlying respiratory conditions.
Definitely always better to be safe than sorry.
Absolutely.
Oh.
Now let's talk about prevention.
Mm.
How can we minimize our risk of getting these infections in the first place?
Well, the most important thing is good hygiene.
Yeah.
Washing your hands frequently and thoroughly with soap and water for at least 20 seconds.
20 seconds, got to time it.
That's right. And if soap and water aren't available, use an alcohol-based hand sanitizer.
Okay.
And staying up to date on your vaccinations is also crucial.
Right.
The annual flu shot is recommended for most people over 6 months of age.
Okay.
And there are pneumococcal vaccines for different age groups and risk factors to protect against pneumonia.
So vaccines are really important for prevention.
They are a key tool in our defense.
Okay, so besides hand washing and vaccines, what else can we do?
Well, avoiding close contact with people who are sick is a good idea.
Yeah.
If you're feeling under the weather yourself, stay home to prevent spreading the illness.
Absolutely.
Huh.
And we should all be practicing good respiratory etiquette,
Right. Cover your mouth and nose when you cough or sneeze.
ideally with a tissue.
Exactly. Then throw it away and wash your hands.
Okay, so simple things, but really effective.
Very effective. What about our indoor environment? Can things like air purifiers make a difference?
I've heard that they can.
Yeah, air purifiers with HEPA filters can help trap those airborne particles.
What?
Dust, pollen, even some viruses.
Oh, wow.
And when you're choosing an air purifier, look for the CADR,
What's that?
the clean air delivery rate,
Okay.
which tells you how quickly it can purify a room of a specific size.
Okay.
And make sure you replace the filters regularly,
Right.
because otherwise they won't work as well.
Good point. And I think it's always a good idea to stay informed about any outbreaks of respiratory illnesses in your area.
Definitely. And follow any public health recommendations.
Knowledge is power.
Absolutely. Now, you mentioned some less common infections like Q fever and hantavirus pulmonary syndrome.
Right.
Should the average person be worried about those?
Well, they are less common than the typical cold or flu,
Okay.
but it's still good to be aware of them.
Especially if you have certain lifestyles or occupations that might put you at higher risk.
Exactly.
So what are those?
Q fever is caused by bacteria,
Uh-huh.
and it's usually spread through contact with infected animals like livestock.
Oh,
So if you work with livestock, be careful.
right.
Hantavirus pulmonary syndrome is a rare but serious illness spread by rodents.
Rodents.
Yeah. So if you're cleaning areas where rodents might be present, be very careful.
Okay.
Wear a mask and avoid stirring up dust.
Right.
Because the initial symptoms can mimic the flu, but it can quickly progress to severe breathing problems.
Oh, wow.
So while not widespread concerns, it's still good to be aware of them.
Especially if you have potential exposure.
Right. Awareness is key. Okay, now let's talk about our overall lifestyle and how that impacts our susceptibility to these infections.
Right. A strong immune system is your best defense.
Mm-hmm.
And a healthy lifestyle is the foundation for that.
So what are some of the key things we should be doing?
Well, a well-balanced diet is really important.
Like what kinds of foods?
Fruits, vegetables,
Uh-huh.
those provide essential vitamins and antioxidants.
Okay.
Lean protein is also important for antibody production.
Antibody production.
Yeah, and limiting processed foods, sugars, and unhealthy fats can really help support your immune system.
So basically, eating a healthy diet is good for everything.
Pretty much.
What about exercise?
Exercise is also crucial.
How so?
It stimulates your lymphatic system,
Okay.
which is a key part of your immune function. It can also reduce inflammation and improve the circulation of immune cells throughout your body.
Okay.
So aim for at least 150 minutes of moderate intensity exercise per week.
That's the general recommendation, right?
Exactly.
Okay, and what about sleep? How does that factor in?
Sleep is super important.
Yeah, I know. I love sleep.
Me too. Most adults need around 7 to 9 hours each night.
7 to 9.
That's the sweet spot.
Okay.
It's vital for immune cell repair and regeneration.
So sleep is like the body's reset button.
Exactly.
Okay, and what about stress? We all know stress is bad, but how does it actually impact our immune system?
Chronic stress can really suppress your immune system.
Okay.
It increases those stress hormones, which can weaken your immune defenses.
So we need to manage stress.
Absolutely. Things like mindfulness meditation, deep breathing exercises, even just engaging in hobbies that you enjoy.
Okay.
Those can help mitigate the effects of stress.
And boost our immune system.
Exactly.
What about supplements like vitamins and probiotics?
While a healthy diet should always be your main source of nutrients,
Right.
certain supplements might be beneficial for some people.
Like what?
Vitamin D, vitamin C, zinc, especially if they have deficiencies. And probiotics, which are beneficial bacteria, those can play a role in supporting gut health.
Okay.
And there's growing research on the connection between gut health and the immune system,
Really?
including our defenses against respiratory infections.
That's fascinating.
It is certain strains like lactobacillus and bifidobacterium have shown some promising results.
Okay.
But as always, talk to your doctor before taking any supplements.
Absolutely.
Yeah.
Now, we talked about this a bit earlier, but let's dive deeper into respiratory infections in children and older adults.
Yeah.
Because they do seem to be more vulnerable.
They are. Children have unique challenges because their immune systems are still developing, and their airways are smaller, which makes them more prone to breathing difficulties.
Right.
They also tend to be in close contact with lots of other kids.
At school and daycare.
Exactly. Which can easily spread germs.
Yeah.
Plus, they might have trouble articulating their symptoms.
Oh, yeah, that's a good point.
And exposure to secondhand smoke can further increase their risk.
Okay, so for kids, good hygiene and nutrition are really important.
Absolutely. Now, older adults often experience a natural decline in immune function as they age.
Okay.
It's called immunosenescence,
Immunosenescence.
a fancy word for aging immune system.
Okay.
They're also more likely to have underlying health conditions.
Like what?
Things like COPD, heart failure, diabetes, which can increase their risk of complications from respiratory infections.
Oh, wait.
And they might not present with the typical symptoms.
So it can be harder to diagnose.
Exactly. So for older adults, a vaccination against influenza and pneumococcal disease is particularly important,
Okay.
as is seeking prompt medical attention if they develop symptoms.
So for both young kids and older adults, it's about being extra careful.
Absolutely. A proactive approach is key.
Okay, so what are some specific prevention strategies that are especially important for these groups?
Well, vaccination is at the top of the list.
Right.
Making sure they get their annual flu shots, pneumococcal vaccines, and other recommended immunizations. Pertussis and even RSV vaccines, where applicable hand hygiene is crucial for both the individuals and their caregivers.
So everyone's got to wash their hands.
Absolutely. And avoiding close contact with anyone who's sick.
Right.
And if someone in these vulnerable groups does get sick, they should stay home to prevent further spread.
Makes sense. So what are some red flags for caregivers to watch out for in infants and older adults?
In infants, watch for things like feeding difficulties, increased irritability, lethargy,
Okay.
and any changes in breathing.
Right.
Rapid breathing, labored breathing, where their chest pulls in with each breath,
Okay.
or nasal flaring.
Nasal flaring.
Yeah, when their nostrils widen when they breathe.
Oh, okay.
In older adults, watch for confusion, mental status changes,
Right.
worsening of any pre-existing conditions, and